And tonight, as always, this free crash course is being brought to you by LW Pharmacy School. We are excited to help you guys as you push through and get started with your testing or with your studying. If you haven't already started studying, this will definitely give you that jump shot or jump start that you've been looking for. And so this free crash course is brought to you every second Monday of the month at 7 p.m. Central Standard Time. Tonight, we're going to talk about the immune system, drugs that are used to treat the immune system. We're going to talk about suffixes, routes of admin, and then MOA, and then we'll open it up for questions and answers. One of the things that I wanted to share with you all is sometimes when you are studying for this particular exam, you are trying to study all 200 drugs at one time. And that just hasn't been really successful for a lot of people. And I don't want you to get overwhelmed, like trying to remember all top 200 drugs all at once, because that is not going to work. And, there's a better way to do it. So, what I've done is I've broken the drugs down by their systems that they treat. So, tonight we're going to talk about the conditions of the immune system. And then, if this works for you guys, then on the next video, we could possibly talk about, another body system that is being treated by a particular set of drugs. Okay, I want to talk about some of the conditions that are used or that happens to the actual actual immune system. So, these, of course, this is not all of the conditions that affect the immune system, okay? Bear with me. I only have 45 minutes here. I don't have time to list everything. However, these are some of the conditions. These are more of the more common conditions that you will hear about. And I'm sure there are more common conditions, but these are the ones that we're going to talk about tonight, okay? So, again, this is your free crash course for April 2020, brought to you by LW Pharmacy School, and we're going to talk about the conditions of the immune system. The urinary tract infection, which is also known as the UTI, ear infections, lower respiratory infection, abscess, like a tooth abscess, right? Pneumonia, respiratory infection. So you have lower respiratory, then you have the upper respiratory. Acne, bronchitis, walking pneumonia, chlamydia, the pulmonary infections, HIV, herpes, chickenpox, and then the big baby right now that we're all, praying against is COVID-19. Okay, they're still trying to figure that one out, but it definitely affects the immune system. Okay, look at what I did. Oh my God. So we're in a different world right now. We're in a different time. And I just thought that I would do something different to help my friends. So what I've done is I put together this chart. And if this is helpful, please let me know, because I will do it for everyone. And then what I can do is give you a template where you can download and you could create your own chart. And what I'll do is just kind of leave the title, the indication, side effects, drug name, special consideration, and then you can use your top 200 drug list and you can fill it in. But I thought this is the coolest thing. Like, I want to tell you, I'm feeling myself in quarantine right now. Okay. Yes. So I really think that this is going to help you. Let's get into it. Okay. If you don't know what this is, I'm going to share it with you. This is the top 200 template that I've created, and I've broken it down by the system. So this system is going to be, or this particular chart is going to be used to treat the immune system. Here is the classification of the drug, and then right here I put the words down. Yes, I did. And then this is the indication. So, what is this particular class of medication used to treat? Then we got the side effects, nausea and vomiting. And then we got the drug names, generic and brand, and then special consideration, avoid sunlight, drink lots of water, and that sort of thing. I thought that this was like super duper cool. And I really think that this is going to help you to remember your drugs. Okay. And it just kind of puts everything into perspective for you so you can see it. I think that when it's not mumble jumbled into the chapters, it's going to be easier to remember. Okay, so let's go through it. Sulfonamides. Okay, so the stem word for sulfonamides is sulfa. Okay, the stem word for sulfonamide is sulfa. The indications for this particular drug is used for UTIs, ear infections, and lower respiratory infections. Okay, and then we also have side effects. Okay, so the side effects that is used to treat is nausea and vomiting. Sorry, not the side effects that is used to treat. The side effects that come from the drug is nausea and vomiting. Now, I'm going to tell you that there were a lot more side effects that were listed underneath this particular class of medication. What I tell my friends who come and we work together one on one, I always tell them pick side effects that you can remember. Pick things that you can actually remember instead of trying to pick these big, crazy side effects that you don't even really know what they do, and then they're hard to remember. If you can pick something that is familiar to you, something that you can relate to or connect to, it's going to be easier for you to remember, okay? The generics are here. I'm not going to butcher those names tonight. You're not going to even get me caught up in that. But what I did do is I highlighted them in bold because I wanted you to see the what? The word stem. Okay. What I realized I did leave out was the if it's an antibiotic or whatever, and all of these are antibiotics, and I don't even think I put that on here. I just was too excited. So I can go back and add that later before, probably in my description. But sulfonamides is an antibiotic, and Bactrim is the brand for this one. And then you see the brand here, another brand, and you see sulfa. So when you think about sulfonamides, think about sulfa, like sulfur 8. So if you actually see a drug that starts with sulfa, then you know it's an antibiotic and it's used to treat urinary tract infections, ear infections, and lower respiratory infections. Okay. When a person is taking this particular drug, they want to make sure that they avoid sunlight and that they drink lots of water. Okay. To my friends, I cannot see you all. So if this looks fun, if this looks cool, and if you can already kind of like see yourself using this, please drop something in the chat and give me some encouragement right now so I can know this is working for you. The next one is penicillin. Okay, so penicillin is going to be the ending for this particular drug or classification. And the indication is abscess. It also used to treat pneumonia and then respiratory infections. Okay, the side effect here is diarrhea and hives. Hives is pretty, it's something that you've seen before. Thank you. Thank you for saying something. Yes, yes, yes. Thank you. I like that. I just need a little feedback. Everybody need a little encouragement sometime, okay? And so this particular one, I picked diarrhea and hives because it's something that everybody can remember. For the most part, everyone is, have either seen diarrhea or hives on somebody or have had it or whatever. So I just felt like it was easy for you to remember. Amoxicillin is the generic and Amoxil is the brand. I just got word the other day that Amoxil is no longer being manufactured. Some of you all in the pharmacy may see it on your shelf, but I've just got word that it's no longer being manufactured. Okay, so I did list it just because, but it's a possibility that they no longer create it. Then we have amoxicillin clavate, which is augmentin, and then we have ampicillin, which is omnipen. If you look, you'll see psyllin, and psyllin is here. Okay, that's a really easy one. And again, we're going to take this step by step. I wanted to make sure that what I was doing was something that was even relevant to what we're dealing with right now. And everybody is talking about how we need to build our immune system to keep from getting the COVID-19 and all of that. And so I thought that this was really great, a great way to kind of tell you about the immune system as well as trying to build it. And I got like a little tip down at the bottom as we go through the slide that you'll see that can help build the immune system. Special considerations with penicillin, it says to take on an empty stomach with water. With water. So you cannot take this drug with soda or juice. Penicillin, any psyllins, no soda or juice. Make sure that it is taken with water. Y'all probably didn't even know that. Okay. Cephalosporin, cephalosporin. Okay. Let's look over here. Cephalosporin is also an antibiotic. Typically, used for dental work, pneumonia, and upper respiratory infections. Do y'all see like this correlation that's happening? Come on, I know y'all see this. Okay, I'm telling you, this is going to really help you. What I'm going to do is once I'm done, I'm going to put in the link inside the description, a link for the template, Carolyn. So you'll see that where you can actually download it and use this yourself if this is being helpful for you guys. And we can talk about this at the end. Side effects. The side effects of cephalosporin is diarrhea and hives. Diarrhea and hives. Now, isn't it the same thing here? Okay, I'll just keep going. I'm going to show y'all some stuff. Cefdinir, CEF, Omnicef, CEF, Keflexin, I think I said that right, Keflex, CEP. So I know somebody's going to say, oh my God, CEF and CEP, that's different. Well, they kind of make the same sound, right? And I'm not going to get into all of it because that's grammar and I'm not here for that. I just know Cephalexin, Cefdinir, they sound similar, okay? Let's just go with that. Let's just keep it at that, okay? And then this last one in Suprex. Now you'll see again, CEF, CEP, CEF, they all make the same sound. Now again, like I told you, there are a lot of other drugs, there's a couple other drugs that can fit underneath this category for cephalosporin. I put 3 down because that's what I'm allowed to do inside of this table. When I give you the link, you can put down as many as you want to, but for right now, we're just trying to get through the slide. Okay. May have cross sensitivity to penicillin. So if they're taking cephalosporin, it could have some type of cross sensitivity to penicillin. So we need to be very careful when we're in the pharmacy and we are filling cephalosporin. So I always, practice when I'm in the pharmacy and I'm using my my counting tray. I always wipe my counting tray down with alcohol once I'm done counting penicillin because so many people, can have an allergic reaction to penicillin. It's one of the common drugs that are known to have an allergic reaction to. And so I always make sure that I wipe down my counting tray to make sure that I don't spread anything to the next drug, right? And so that's something that you can start doing, now that you know that. If you count penicillin, most of the time your pharmacist will kind of encourage you to wipe it down. Even if they don't now, you know that there's something you can do because you will see that some drugs do have a cross sensitivity to penicillin. Tetracycline. So the word stem here is cycline. And it is used to treat acne, bronchitis, and walking pneumonia. Okay. The side effects is nausea and vomiting. Oh my God. Oh my God. There's nausea and vomiting again. It was just over here. Now it's over here. Again, like I told you, you're going to see multiple side effects. Why wreck your brain trying to learn something new? Look, at this point in time, we're just trying to pass this test. Put it together with something you already know. It's like when you go in the kitchen and you make a meal. You try to put your chicken together with a baked potato, something you already know. You may not cook quinoa that night. For me, when I'm doing a new dish, I try to make sure that I'm not doing too many new things all at one time because sometimes it can be a little overwhelming. Same way here. Try to include the new things in with the old things, stuff you already know. Drug names. Generic is going to be doxycycline. The brand is Vibromycin. Doxycycline again, monodox, and then minocycline, and then minostem. So that's kind of easy to remember. And again, I've highlighted the prefix and the suffixes towards the end. With this particular drug, we want to make sure that they avoid sunlight and pregnant women. Okay, so make this note if you haven't written anything down all night. You want to make sure that doxycycline, you remember pregnant women cannot take this drug. No pregnant women. And another thing is if someone is going to take this particular drug, they need to wait a couple of hours to use dairy or to take antacids. And that's because it decreases the drug effectiveness. And so if they take it too soon, then, it can decrease the drug effectiveness. I'm going to get like a little candy because my mouth is getting kind of dry. And so that's one of the things that you really want to remember. What I did want you all to see is how, again, I kept it very simple. And I'm encouraging you all to keep it very simple. You are not going to remember all these top 200 drugs all at one time, okay? There are drugs, I've been in pharmacy for over 11 years. There are drugs I still don't know. And that's okay. You know, you're not being paid to know every drug. You're being paid to make sure that you prevent medication errors and that you follow the law and that you can actually assist the pharmacist. But nowhere in the description of pharmacy technician does it say you have to know every drug. Uh-uh. Nope. And I'm not going to let you wreck your brain trying to do that, okay? All right. So here we go. We're moving on. Uh-oh. Macrolides. Look at my, every time my screen just started jumping from slide to slide. I don't understand it. We're still talking about drugs that are used to treat the immune system. Macrolides, they're, the word stem from macrolides is mycin, MYCIN. And this particular classification is used to treat chlamydia and pulmonary infections. Do y'all see that? The side effects here is nausea and vomiting. Nausea and vomiting. And then we have azithromycin, zithromax, clarithromycin, vaccine, and then erythromycin E and EES, okay? And the word stem is mycin, MYCIN, MYCIN. This particular drug says that we must take it with food, okay? And so I'll tell you just like a quick little story. I took azithromycin probably back in November because I was actually getting ready to travel to South Beach with my husband for his birthday. And at the time, I needed to get some dental work done. And so I was like, oh my God, I don't want to go to South Beach and have a toothache and all this craziness. So I went to the dentist, and so my dentist was like, Lindsay, this is a strong antibiotic. And I'm like, whatever, I know about antibiotics, I can take this. And so, anywho, I took it, I felt fine. And then I would notice every time I got hungry, or I didn't necessarily feel hungry, but I guess whenever the food was like being depleted from my body, I would begin to feel very weak. And one thing I remember about being on azithromycin was that I needed to keep a full stomach at all times. It was like the moment that my stomach was not full or was empty, I began to feel very weak and I just needed to sit down. And it had me feeling lightheaded and it was just crazy. And so, anywho, I wound up talking to my dentist and we switched to something else. But when it says take with food, this is very serious. When it says take with food, and for me, you know, maybe my body just couldn't handle it. And so, anywho, I switched over. And so, this is a very serious thing when it says take with food. So, hopefully, you'll use that story and you'll remember when you're taking your test. If they ask you a question about that, just remember it had me weak. Okay, when I did, and I ate with it, but I think I needed to keep a full stomach. And I could tell the difference. The next one is quinolones, and I forgot the N here, did it again. Floxin is going to be the worst stem. And indications is going to be urinary tract infection and upper respiratory infection. Urinary tract infections is also known as UTI, and then upper respiratory infection is also known as URI. So if you see URI in your particular test or on some, you know, type of question or whatever, know that they're talking about an upper respiratory infection. Okay, yep, just gave you another tip. Better write it down. Side effects is nausea and vomiting. The drug name is ciprofloxacin. For generic, brand is going to be Cipro. Levofloxacin. Then you have Levaquin. Levaquin, by the way, is a very strong antibiotic too. And then we have Vigamox. Please make note that Vigamox is eye drops. These are eye drops. So if you didn't know, you want to write this down because one of the things you'll see on your blueprint is it talks about you needing to know or that you needed to know dosage form. I'm going to tell you like I tell everybody else. Before you can learn the dosage form, you need to learn what the medicine is. Okay, I didn't put dosage form or anything like that on here because I don't want to overwhelm you. Okay, I want you to build confidence. I want you to build, a relationship with pharmacy. And I want to make sure that as you introduce pharmacy into your brain, that it's introduced in a very relaxing way that will allow you to, take it all in and take it in a calm, friendly way. Okay. We don't want to take it in where we're like, oh, this is a chore. Oh my God, I can't do this. Oh my God, this is the worst thing ever. No, because then the way you process it now, that's the type of energy you're going to give back on your test. So take this in one step at a time, one day at a time, and allow it to be something that you enjoy and not a chore. Okay. So Bigamax is eye drops. Okay, special considerations here is going to be antacids interfere with the way that this medication is absorbed in the body. Okay, so when we talk about antacids interfering with the absorption, what kind of indication is that? Is that drug to drug indication? Is that not indication, drug to drug interaction, drug to food interaction, drug to lab interaction? Tell me what kind of interaction this is when antacid interferes with quinolones. And you can drop that comment down in the chat. Those of you who are watching, you can also leave me a comment underneath our YouTube channel with the correct answer. And I'll repeat the question again. What kind of interaction happens when antacids interfere with the way the drug is absorbed? Is it drug to food, drug to lab, or drug to disease interaction? Okay, think about it. The other one says that we need to make sure that this drug avoids pregnant women. Write this down. Quinolones, and I didn't spell that right, but it's like Quinolones. Okay, forgive me. Okay, please make sure that you remember that it says to avoid pregnant women. This drug should not be taken by pregnant women at all. Yes, it is a drug to drug interaction. Very good, y'all. Very good. Okay, we're going to move on. Aminoglycosides. Yes, I said that right. Aminoglycosides. The word stem is mycin, MICIN, or MYCIN. Indications, life-threatening infections. Oh my God, life-threatening. Side effects, immunocompromised patients too. Yeah. The side effects here is toxicity in the kidney. Toxicity in the kidney. When this said that it is used to treat life-threatening infections, I can almost see that a side effect would be toxicity in the kidney because it is fighting against something very strong. I almost think about chemotherapy. When chemotherapy works, it kills good cells as well as bad cells, right? It kills the good white cells as well as the bad white cells. And so when that happens, when I think about life-threatening infections, I can almost imagine that it would, put out some bad because it has to be very strong to fight off this, whatever it is that's trying to take over the patient. We have gentamicin, okay, and garamicin, and then we have tobramycin and nepsin. Now you'll see here that you'll see the word stem in generic and in brand and generic again, okay. Most of the time when you see the word stem, it'll, for the most part, you'll see it in generic more so than you see it in brand. In pharmacy, we tend to dispense generic more so than we do the brand, just because that's what we carry in stock, and most of the insurance companies will cover generic before they cover the brand. Special consideration here is that the patient needs close monitoring. You would think that if they're on some type of life-threatening or a medication that is used to treat a life-threatening infection, that they would need some close monitoring, because that means that this drug is pretty strong. Okay, let's move on to antifungals. Antifungals. When I think about this, I think about a wingworm. Let me tell you, my 6-year-old son had a wingworm in his head. I don't know how he got it. Don't even ask me because I don't know. It's like, where did this come from? I promise we are not dirty people. And he doesn't even play in dirt like that. I mean, normally if a kid is playing in dirt or playing in sand or something like that, you'll kind of see, but we don't really have like things like that. Anywho, this kid got a ringworm in his head. So I use bleach, because old school tells you to use bleach. So I used bleach or whatever, and that didn't work because what I learned is bleach works on the skin, but it doesn't work in the hair because once it gets in the head, the fungus grows from the hair follicle and not on top of the skin. So now the fungus is underneath the hair follicles or underneath the skin and it's growing from the body. So now you got to take an oral medication in order to kill the wingworm when it gets in the head. I'm telling y'all, I learned so much. I was like, oh my God. And so anywho, I took him. The drug that he actually took is not on here. It's called Glucifin, Grisofulvin. I think that's right. Grisofulvin, somewhere like that. And so it was a suspension drug, and you had to keep it on the counter. But it is also an antifungal, and we had to use that in order to treat it. And Lotrum also treats a wingworm, and that's something you can buy over the counter. They have it over the counter now. But I mean, it was really scary. And I was like, oh my God, and I know you're like, this is just a wingworm, Lindsay. But they could spread him. He could have went bald and it was just like, the worst thing ever. And so whenever I think about antifungals, I think about wingworms. So if you like want to figure out what is in, because this says fungal infection. So it could be a wingworm, it could be athlete's foot, it could be maybe a nail infection, like if you're going to the nail shop. Well, right now, nobody's going to the nail shop, so we're like looking like this. But anywho, it could be any of those type of fungus that you could actually get or that someone could get, and they would use these type of medications. Diflucan is used for a yeast infection, right? And so, which is fluconazole, and so it is used, to treat yeast infection. And then you have ketoconazole. Don't laugh at me. Monostat, okay, also used for yeast infection as well. And so those are considered fungal infections. Special consideration, fluconazole suspension refrigerated is only good for 14 days. And I'll give you a hint, give you a lifeline, give you some tips. Most reconstituted medications are good for 14 days. That's it. I'm going to tell you, moms, dads, parents all over. I know that, we tend to try to keep a hold on to medications because we feel like it. Well, if Billy got it, it's only a number or a matter of days before Jimmy gets it. The thing about that is if Billy's medication expires, on Tuesday and you save it till Friday and you give it to Jimmy, now we got a whole nother issue on our hand because now you just gave this baby bad medicine. And so please remember, that it's only good for 14 days, refrigerated. After that, it needs to be discarded. Okay. Antifungals may also decrease birth control. Okay. I'll tell you right now that most antibiotics will decrease the potency of birth control. So that is something that you want to remember, is that it will, definitely decrease birth control. And so most of the time doctors will say, please use another form of birth control, please use another method of birth control, because it can, decrease it. When it comes to the brand and generic drugs that you need to be focusing on, I encourage you to really focus on generic. You need to know the brands, but most of the time the drugs are in the generic. Okay. If you look here, zithromycin, zithromax. So if I would have known that zithromycin, if I would have known this drug and if they would have shown me this one, I would have been able to connect the two. Okay. Cipro and Cipro, right? Levo and Levaquin. I mean, so you can kind of see a little bit of a correlation. I won't tell you that you don't need to know the brand because that's not true. But when you're studying, you want to make sure that you become familiar with the generic. Any of my friends who are already inside of the pharmacy will tell you that the generic is what we dispense because that's what insurance companies will pay for. Okay. And so, anywho, my slide is so excited to move to the next slide. So it's just jumping all over. We're gonna talk about little questions, little questions. Immune system, drug question. Okay, now we just talked about this, so y'all ought to get this right. Which of the following medication is used during if used during pregnancy may result in a birth defect? Which of the following medication, if used during pregnancy, may result in a birth defect? Tetracycline. Somebody said D. Yes. Miss Morgan. Yes. 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 Thank you, Carolyn. I love it. I need it. Okay. Route of administration. Okay. Guess what? I put the inhaler here. And you know, when a person inhales, it goes into the lungs and not into their mouth. That's another question that you may see on your test. Is that I want you to know that oral and inhalation are two different ways. Okay, inhaling goes into the lungs, oral goes into the mouth. Look at that. You didn't know that, huh? I just taught you. I know I did. I just taught you. What is the most common route of administration? Most common route. Somebody said, hey, let me ask you a question. When you go to Walgreens, CVS, Kroger's, wherever pharmacy you go to, do you see a lot of inhalers on the shelf or do you see a lot of pills? I knew it. I knew it. I knew it. Yes, see, oral. Okay. Smartest people that I know. Treatment of influenza. Oh my God. Which of the following medication is used in the treatment of influenza? We just talked about this. Did we just talk about this? Should have seen this. Influenza. Now, I'm going to tell you a trick that I want you to know. When you think about something, the flu is viral, okay? VIRAL, viral. Most drugs that are used to treat something that's viral is going to have VIR in it. Hence the VIR for viral. Oh, you can thank me later. You can thank me later, okay? Yes, look at my friends. Oh my God. Y'all, this is what I'm talking about. This is why I enjoy doing this because I get smart people who come in and know what they're doing. And so the answer to that question was D. D as in dog, okay? Prefix question. Prefixes are often useful in determining the drug class of a medication. Didn't I just tell y'all this? I didn't make this question up. This is a true question. Which of the following prefixes is correctly matched to its drug class? Is it sulfonamides, self or self, estrogen, ESTR for cephalosporin, or profen for anti-inflammatory? What y'all think? Do not get tricked. Look at some answers coming through. Y'all better give me these answers. Yes, the answer is A. Sofa. Very good. I'm so excited. I'm so excited. Oh my God. Okay, mechanism of action. Which of the following mechanism of action is correctly matched to its antibiotic class? Penicillin prevents bacteria from forming a cell wall. Sulfonamides inhibit the protein synthesis in bacteria by binding the ribosomes. Cephalosporins interfere with folic acid formation, and tetracycline prevents bacteria from forming a cell wall. What would y'all say? Somebody said D, question mark. This is Miss Morgan. Hey, Miss Morgan. What would y'all say? Somebody said D, somebody said B. The correct answer is A. Penicillin prevents bacteria from forming a cell wall. Penicillin prevents bacteria from forming a cell wall, which makes the bacteria grow, right? And so it was tricky. This was a tricky one. I put this in here because I know y'all felt like y'all was just like zooming through those questions. I was like, okay, I got to do a little something to trick you all up. Let's see. Oh, okay. Here's my little tip. We're almost to the end. I'm trying to keep this 45 minutes or less, guys, because I realize that, we are kind of in quarantine, but I don't want to be, taking up all your time and all of your, your night with your family. Okay. 12 tips to strengthen your immune system, and I've listed them here. I did not make these up. This came from WebMD. Okay. I just figured that I would share this with you, just because of what we're going through right now, and because we just learned about the immune system. So, we want to stay positive. We want to make sure that we are exercising. This one says build your social network. Obviously, we want to do that virtually. We want to make sure that we are practicing social distance as much as we possibly can. Here's the 4-step self-taught program with Lindsay, okay? And so, doing this self-taught program, this is good for you all who may have taken the course before, somewhere else, and you feel as though, oh my God, I took this course. I don't know if I'm gonna pass it, whatever, whatever. You can come and work with this chick, okay? This girl here is the bomb. And so far we have over an 85% pass rate. Let me tell you something that we did. So I understand what's happening around the world. And I went and I sat down with the team and I said, you know what, we have to do something. I don't want us to continue to, keep watching our friends try to study. I feel like right now this is a time where we all need to come together and to spread, love and support and peace. And so we went and we came up, and so we're giving over a 30% discount, to anyone who wants to work with us, work with me. It's a 4-step, program. Basically, in this program, what you're going to do is you're going to purchase this book. That's the first step. The second step is you're going to book your sessions. Okay. The third step after you do that is you are going to begin to work with me. And then the fourth step is going to be you taking the actual test. We're giving 6 one-on-one 120-minute sessions, which is 2 hours. And we're giving that away at the price down here. We have discounted it, and you're actually getting 2 extra or 2 free sections, because of what we've done. I want to make sure that during this time, you guys get the opportunity to put your best foot forward. I don't want you, to use. So many people right now are looking at COVID-19 and they're like, woe is me. This is the worst thing that could have happened. It has thrown off my plans. It has rearranged my life. There's so much out here that I thought that I was going to be able to do. And now I can't do this because of this, and so on and so forth. I was supposed to take my test. I was supposed to get this job. I was supposed to start this job. I was supposed to go here. I was supposed to do all of the things that everybody is saying that it has done. And I want you to look at this and see it working for you. Okay. Um, and because of that, I wanted you to know that we're on your side. We're not here for you to lose. We're not here for you not to win. We obviously want to see you win, and we want to see you do your very best. Okay. And so, because of that, we put together this package. You can call me, 903 extension 101. You can email me at info@lwpschool.com. And this is going to be going on for quite some time, okay? I want you to take some time. I want you to think about where you are in life and where you want to be, okay? I don't want you to use this time not to work, towards your certification or towards your career goals. I want you to utilize this time in a way that is going to boost your confidence, okay? And obviously that's going to come with practicing your test information. That's going to come, with making sure that you are putting, positivity around you. Right now, you may not be able to talk to everybody on the phone because some people may be in a woe is me place, and then some people may be in another space, and so you want to just make sure that you keep positivity around you. Obviously I had some issues getting to you guys. Every time I would record a video, it would disappear on my computer. That has never happened to me. I called Zoom, they didn't know what it was. I chunked it up to the fact that there are so many people who are using Zoom right now. And so I said, you know what? I'm going to get to you all. And that's why I did this crash course at the last minute today. Okay. I woke up today and I said, you know what? I'm going to do a crash course. I miss you all. And so, with that being said, we have to persevere. We are resilient people. We are confident. We are strong. We are courageous. We can win this. Okay, this is not something that we die to. This is something that we get strong and we grow. Okay, and so with that being said, let's get together. I want to work with you. I want to make sure that you understand what you're supposed to be doing. When we work together, we're going to be utilizing this book and we're going to go through this book. Okay, I have highlights in here. My friends will tell you, like, I'm to the point, I'm straight to the point when it comes to actually working together and making sure that you are getting the information down pat. Okay. If for any reason, you are struggling and you don't understand what you don't understand, also give me a call. I want to make sure that we can work together in order for you to be great. Okay. Continue to do the best that you've been doing. Continue to be who you are. Don't let anything change you. Don't let this time change you. Let it motivate you so that way you can be the best you that you could possibly be. I've enjoyed all of you all tonight. I know that this is only the beginning of a brand new story, and this is something that we're going to remember 5 and 10 years from now how we all made history. Keep your heads up, stay positive, don't give up, don't give out, don't give in, and continue to do your very best. It's working even when you can't see it. Thank you so much for getting on tonight. And I look forward to seeing you guys next month on the second Monday at 7 p.m. Central Standard Time. Okay. Take care of yourself. Continue to stay well and continue to wash your hands and do everything that you can in order to maintain your health. Okay. Take care. God bless you all. Bye.